Croesawu pawb I briefio eno. Welcome tonight, everyone, to tonight's briefing. Now, before we begin, I'd just like to provide a brief technical introduction. We're using Microsoft Teams today, and this means that not only can you watch the meeting, but you can also take part. So if you're using Microsoft Teams, then on your screen you should see a tab with a question mark on it, and this will normally be in the top right of your screen. And if you click on this, it will give you the opportunity to ask questions today. Please accept our apologies that we may not be able to answer all of the questions during today's meeting, but we will continue to update our website with all the latest information about COVID-19, as well as our other plans and priorities. Microsoft Teams also offers you the opportunity to see live subtitles of today's proceedings. You should see a button in your settings to switch those subtitles on. And subtitles for today's meeting are available in Cymraeg and English, as well as Arabic, Polish, Bulgarian, Slovak and Urdu. Some of you today will be watching via Facebook as well, via Facebook Live, and you can also use Facebook to pose your questions, which we can put to Carol Shillabeer tonight. Today's meeting is being recorded. Now, don't worry, it doesn't share information about you in the audience, just the information you see broadcast on the screen today. That means that people who aren't able to join us this evening will still be able to watch the briefing in future. So thank you very much for joining us, and our briefing will now begin.
Diolch, Adrian, prynawn da pawb. Evening, everyone. Lovely to be back with you in what has been a pretty regular feature for us in terms of our engagement with you throughout this year. I do hope that the presentation this evening is informative. And of course, as always, as Adrian has said, there's an opportunity to ask questions and to make comments in terms of any matter relating to healthcare. So I'm going to start in the rather traditional way that we've started all of these briefings with COVID-19 update. And the reason we're again starting with this is, of course, that the pandemic is not over. And whilst many of us are enjoying the activities that we used to enjoy before the pandemic, we are still very much in the midst of the pandemic itself, with some very high case rates here in Powys. That reflects the case rates across Wales and across the UK. And if you look further afield, certainly high case rates across Europe. But Wales is at alert level 0, and so there are many of the restrictions that we experienced previously in waves 1 and 2 of the pandemic. Those are no longer in place, and I will come on, as always, to the progress that we're making on the vaccine, because it is because of the vaccination programme and the fantastic approach of our communities in taking up that vaccine, not both here in Powys but across Wales and the UK, that the government feels able to have a low level of alert. I just want to say, though, that whilst the legislation in place has removed some of those restrictions, and indeed the legislation itself has very much been lifted, that we're really relying on people to do the common sense thing, in a sense that we now know that hands, face, space and fresh air are really important to try to protect ourselves and our friends and our families from the pandemic. So I make no apology for just reminding ourselves about the importance of that, and the actions that we can take, whether there's legislation or not, to try to maintain safety as much as possible. Now, our very high rates of COVID are significantly challenging, but I would just indicate that our testing, trace and protect service is doing its absolute utmost to keep up with those high levels of cases. In fact, recruited more people into this. And that's because the case rates have been climbing, certainly from the summer period, and they're still very challenging. We have seen a slight dip when it was the half-term week, but we're not really seeing that dip go down any further. And in fact, over the last couple of days, we've seen some of the cases rise. It is particularly the case that young people have, as a group, have high rates of COVID infection. And of course, they have been the group that have come into the vaccine programme the latest. So I'm going to touch on that in a little bit more detail shortly. But you can see that our case rates are 521 per 100,000 people, and that's just in the last 7 days. So it is absolutely well and truly still here with us. Just in terms of testing, by way of reminder, we've got PCR tests. They're available for people with COVID-19 symptoms, and you can see that they are widely available around the county. We've got PCR tests for people with a wider set of symptoms beyond those classic COVID-19. And for those members of the public and communities that follow the Zoe app, you may well have seen Tim Spector pushing very hard the awareness of those wider symptoms that do signal, particularly in those who have been vaccinated, that there may be a COVID infection present. And then, of course, lateral flow tests are available for people without symptoms. You can get those by post and from collection points across Powys. This week there are LFD roadshows in supermarkets. I couldn't imagine 2 years ago saying we're going to have an LFD roadshow in a supermarket, but that is where we're at. We're determined to make sure that we've got testing available to make it as easy as possible. And if I can just give a bit of feedback, that Powys is testing more people, particularly in the younger age group, than other parts of Wales. And so I want to thank young people in particular for coming forward and getting tested. That is probably why we've got the highest rates, one of the highest rates of young people's cases. That's because we're testing and we're looking for it. So thank you very much for that, and keep doing what you're doing. Our next slide gives us an indication of the vaccine programme. So for those people who have tuned in very regularly to these updates, it is now just a couple of weeks until we have had our vaccine programme in place for a year. So the 8th of December was the first vaccine that we gave here in Powys, and we got off to a great start then, and I'm going to share some of the data about where we have got to more recently. But I want to just focus for a moment on first and second doses, and that's because there are still people in Powys who have yet to come forward for their first dose, and some for their second dose as well. So I do want to encourage people who've perhaps been a bit hesitant about this, a bit concerned. Please do come forward and get some advice. We're happy to talk you through the pros and the cons and any queries that you have to support you to make a decision. Because what we do know is that people who are unvaccinated and become infected are much more likely to be very seriously ill and sadly die as a result of COVID. I also do want to say, and I will touch on it a little bit later, but in particular, pregnant women have been seen to be one of the groups that have had a lower uptake. So again, if you're a pregnant woman, or if you know someone who might be a bit reluctant, please speak to your obstetrician or your midwife to talk that through, get some advice about vaccination. But the great news is Powys continues to be the health board with the highest first and second dose vaccination rates for people aged 18 and over. So it is lovely to see us there at the top of that table. 82.4% is also the percentage that we have for 16 and 17-year-olds, and I'm going to come back to that. So we're highest in first and second and 16 and 17-year-olds, and we're the highest in 12 to 15-year-olds. And I just want to underline the appreciation that we have as a health board for the huge cooperation and support that we have had from communities across Powys and our partners in being able to provide this vaccination programme. It is truly significant, and there is something special going on here in Powys about the rates of uptake here. I was in a meeting with some Welsh Government colleagues the other day who asked me, you know, what are you doing in Powys that means that we've got these sort of uptake rates? And I did reflect the community cohesion and the community spirit, as well as, I think, a very well organised vaccination programme, for which I thank staff involved hugely. If you know someone who hasn't had a first dose or second dose, please do nudge them, and we are always open for vaccine in relation to that. If I can also underline the message about anyone who's aged 12 and over, our 12 to 15-year-olds have been phenomenal. So nearly 62% of them have come forward already. And we know that there are quite a lot of young people in this group who had a COVID infection when we were offering this vaccine. It's 28 days post-COVID infection that you can come back for your vaccine, and we want to make sure that that remains uppermost in people's minds. It is still advised that even if there's been a COVID infection, that people come forward for their vaccination. So there is a drop-in facility available for first doses for anyone who's 12 and over. A bit of news that came through just yesterday, and that's that the JCVI, and for those of you who've tuned in, you know who the JCVI is, the Joint Committee on Vaccination and Immunisation. They recommended, and the government has accepted this, that second doses should now be made available for young people aged 16 and 17, and that's about 12 weeks after their first dose that they'll become eligible. Now, that was announced yesterday. We are going to be working our socks off to try to make sure that 16 and 17-year-olds can get their second vaccination as quickly as possible. And because we were so swift off the mark back in sort of July, August time, when the first dosing was announced, we know that there are lots and lots of 16 and 17-year-olds who are at 12 months, or certainly coming up to 12 months. So we'll be working very hard to support those young people to get their second dose. And that's very useful in time for all the Christmas festivities as well, I'm sure. So this is the 16 and 17-year-olds, which I've touched on, but it really is quite remarkable. So we are certainly hoping that the second dose uptake will be as strong as the first dose. And importantly, the findings of the studies that the medicines regulator has been undertaking shows there's no additional side effects for this younger age group than there is in older age groups around the vaccination second dose. So that's fantastic news. The next slide helps to just outline where we are now on phase 3, because if you recall the early part of the vaccination programme, it was all pretty straightforward. It's got a bit more complicated as we've moved through with different age groups and first and second doses, some people having a third dose, third primary dose, some people then having a booster. So I'm going to run through a couple of the key elements, if that's okay. So We have an always open offer for people who have not had their COVID vaccination. And I am very, very keen that we look to support people as much as possible with their questions and their queries, those who have been very reluctant to come forward. So if you know someone, please give them a nudge, get them to get in touch with us, check their website, etc., and we'll talk that through. Vaccination for under 18s in line with national guidance. So this has been changing quite a bit because, first of all, the 16 and 17-year-olds came on after the 18-year-olds, so they've had a bespoke element. And now we're working on the second dose for those young people, and of course the 12 plus 12 to 15s as well. We haven't heard anything yet as to whether 12 to 15-year-olds will be offered a second dose. So we know that this programme at a national level is evolving, but we are not aware of any plan at this stage to give a second dose to 12 to 15-year-olds. We're very keen to get uptake above the 62% that we're on now, and we'll keep that offer open to young people over 12. Then we've got the big booster programme, and boosters should be offered to those who are at more risk of serious disease and who were vaccinated during phase 1 of the programming in priority groups 1 to 9. So that is people who live in residential care home for older people. It was people above age 50. But just yesterday that has been amended now to people above age 40, so 40 years and over, so that 10-year grouping has just been brought in. Frontline health and social care workers, those people who are age 16 to it could be 39 now, with underlying health conditions, who puts them at a higher level of risk, and adults, carers, and then adult household contacts of immunosuppressed individuals. So I'd want to say just a couple more things about that. For those people who have got severe immunosuppression, so they've on medication or had some sort of treatment that really affects immunity, we are offering a third primary dose. So that the third primary dose is different to a booster dose. So and again, we're looking for people who may be in that category to identify themselves, and we're trying to identify them too through our systems. The JCVI advises, so on booster, that is timed at 6 months after the second dose, and your primary vaccination course. So if you had your second dose in June, then you will be due your booster in December. When JCVI announced this, and that was on September the 14th, we had some people, quite a few people, who had already reached the 6 months. So we're working very hard to vaccinate all those who are just over that 6 month period in order that we can get to at 6 months. And at the moment we're operating at about 6 months to 6 months 2 weeks, and that's where our plan is at this stage. So we're pretty pleased with that. Just moving to the next slide. This gives you a sense of how we're getting on. So this is Jane. Jane is a vaccination team leader. She hasn't done 39,100 vaccines all on her own, but people like Jane and a whole army, a whole array of people make the vaccine programme happen. But we have got to very nearly 40,000 booster doses, which is tremendous news. And so that's about 26% of the total adult population. Much of the vaccine programme on boosters is centred around our mass vaccination centres. Now, just to say a couple of reasons for that. Primarily, we can vaccinate more people in a really big setting. And, you know, we've become slicker and slicker at this, so we're trying to get people seen as swiftly as possible. The other thing, of course, is that we're using Pfizer. And again, if you tuned in regularly to these updates, you'll remember that Pfizer is the one that's a bit more difficult to sort of travel around with. Although in some limited circumstances with special precautions, we can take that out. But it is much more straightforward, much more efficient using the mass vaccination centres. 3 of our GP practices are supporting us, and of course this was quite a tricky one because our GP practices are very, very busy at the moment, and I will come on to some of that shortly, but very, very busy doing a lot of things. So they are offering the flu vaccination, they are providing urgent and emergency appointments, and they are also trying to catch up on the backlog of the planned care that they provide, particularly for people who have long-term conditions that they live with and try to manage. And again, I will mention this a bit later on, the huge challenge we've had during the summer period of staff absence from work. So with this booster programme, a very delicate balance of trying to manage as many vaccines as we can in the mass vaccination centre, balanced with some GP practices. But of course, we've got then the peripatetic service that into care homes and into people's own homes for those who are housebound. So again, quite an expansive programme that we're offering here. If I can just say that people will be called for their appointments as always, and there's a you normally get your letter at about 6 months, 6 to 7 months. But if I can ask anyone, if you haven't had your invitation at 7 months, come and let us know. Let's just double check that everything's in order, etc., etc. But we will increasingly be getting closer and closer to that 6 months. And again, you know that these are my favourite charts on this slide, and we've added in a new colour, a pink. So we started with a grey bar, which is no vaccine, then a green, which is the first dose, and you can see just little bits of green there. The blue was the second dose, and now we're adding in pink, which is the booster dose. So again, we want to see any green lines right across to the right-hand side and get that grey to disappear, and then the blue, and then the pink to follow that. So you can see very openly there where we're making progress on booster doses. So fantastic, and thank you for coming in your hordes and droves, I was going to say, excuse me. But I've certainly experienced the vaccination centres myself, and very busy they are too. So that is fantastic news that people are coming forward. I just keep encouraging you to come forward as soon as you're called. The next slide gives a little bit more information as well around the drop-in clinics. So we are operating drop-in clinics for people for first and second dose appointments, and the first dose appointments for drop-ins are now available for young people aged 12 and over. We're very much focused on trying to target those people who may be unsure about their vaccine, and I mentioned earlier, oh, excuse me, just for a moment. I mentioned earlier the pregnancy issue, so again, just to remind colleagues on that. There are priority access forms on our website, always worth keeping an eye on our website. There's a lot of information there for you to access. I'm going to leave the vaccination parts there for now. There may well be questions that I can pick up on that. Always very happy to answer those. But I just want to cover off two other areas of the health service at the moment, if that's okay. The first one of those is urgent and emergency care. And I'm pretty sure that most people will have seen some of the media coverage around how pressed the NHS is, and in particular its impact in terms of emergency departments and particularly ambulance services. As a health board, we're working with our colleagues in other health boards, in the Welsh Ambulance Services Trust, and with local authority, particularly social services, because what we're finding at the moment is that the system of moving through hospitals and healthcare settings is really challenged. The flow is not flowing. I talked with a colleague the other day and I was describing it as a bath. You have a bath with a plug in it and you have water flowing into the bath. And if you either don't turn the taps off or pull the plug out, the water will overflow. And in some ways, that's how the health and care system is working at the moment. People, unfortunately, are finding themselves stuck in hospital because some of the community services are really struggling with the shortage of staff and an increased demand to try to support people out of hospital. And then when you've got a lot of people in hospital who are stuck there, that channels all the way through right to the emergency department, so the door into the hospital, and in terms of ambulances. Now, we are working very, very hard with our colleagues in Powys County Council, who are under significant pressure in terms of social care and the demand and the availability of services there to support people to get home. Of course, as families and friends, we're very, very grateful to any additional support that you can provide to your loved ones, to your neighbours, in order to help them to be at home and be confident at home as well. But it certainly means that we've got a significant challenge on our hands, and we are yet to get into winter. I'm a pretty optimistic person on the whole, but at this stage, I've got to say that it is particularly challenging. We will do all we can to get through this tricky winter, and hence, members of the public, members of our community can really help us by doing a couple of things. First of all, please get your COVID vaccine when you're called. We are still having people admitted to hospital with COVID. Please get your flu vaccine if you're eligible. And there have been a few challenges on flu vaccine supply, but they are now easing. And so we know that the appetite is very high to have flu vax. So if you've not yet had yours, please do make some efforts to secure an appointment. And pharmacists are also providing flu vaccine. It is really, really important this year to do that. Please stock up on your medication, regular medication, before you run out. So planning ahead is always really helpful to healthcare professionals who are trying to support on the supply of that medication. Please do all you can to be prepared to know where to go for certain things. So again, a big plug for our pharmacy services across Powys. Those high street pharmacists are a mine of information, and that's sort of pharmacy first approach. They have accredited schemes called minor ailment schemes that pharmacists can sort of diagnose and give advice and supply some medication for a range of conditions. So that's a great place to go. We've also got the website and 111 that offers really helpful guides on self-management. And then, of course, I do want to underline that if you have symptoms and that are worrying you, please do come forward to the NHS. We did find during the first wave of the pandemic, understandably, a lot of people stayed away. And sadly, some people really did have quite serious symptoms that we really needed to see. So that helps us enormously. Please don't go to an ED department unless you absolutely have to. The waits are very long, and if there is an alternative source of advice, support and treatment, please access that if you at all can. So there's a lot going on that urgent and emergency care pathway, and I'm very grateful for all of the help and support that that members of the public and our communities can provide on that. We'll keep you in touch with what's happening. The other area I wanted to touch on is the sense of the planned care backlog, people are terming it as. So we have about 19,000 people now in Powys who are waiting for either an outpatient appointment or a procedure. Obviously, not all of that is in Powys and what us as a health board can provide, but in our neighbouring providers. So be that in Shrewsbury and Telford or in Hereford, in Neville Hall, in Prince Charles Hospital, in Morriston, etc., and Bronglais. And I've been in Powys a very long time. I've never had that number of people on a waiting list. So it worries me hugely that there are that number of people who are waiting. What I would say, though, is that there are some very encouraging signs in terms of the work that we're trying to do, and I'm going to give you just a bit of a sense of that if I can. So those people who have been waiting a very, very long time, so over 104 weeks, that's 2 years, that number is coming down. And that is really, really important. So I can just say to you that in our providers across the border in England, we now are down to 33 patients who are waiting over that time. In Wales, it's higher, it's about 300 patients waiting there. But all efforts are being made to try to see people as swiftly as possible. And if it's a service that we can provide in Powys, our performance, our ability to see people has been increasing significantly. And now 8 in 10 people are seen within the 26 weeks, which is the Welsh Government target. Now we're used to being in the 95% and more, and at the moment we're at 80%. So we've got a little bit more to go, but we are making really important progress. Our ability to continue this is predicated on the type of winter that we have. Certainly our district general hospitals, if they have much more demand for urgent and emergency care, that will really jeopardise the ability to do planned care. So we're going to be working very, very hard to try to prevent that. And then I would just want to finish on emotional and mental health. So our services here in Powys have been challenged by the provision, in terms of trying to provide mental health services to all of the people that are requesting that and coming forward. We have seen demand increase, but what I would say is that the services have adapted and adopted new ways of working, and they are very resilient. So people with an emotional mental health issue or worry can get help and support here in Powys. There is something called Silver Cloud, which is internet-based. It's you can go online, type in Silver Cloud, and that will take you to a whole platform that can support often those lower level but very important anxieties and concerns. And so we're hoping that people will engage with that. We've had fantastic feedback about its impact. So if you know somebody who may be feeling very anxious or down, not sleeping well, there are different modules in that Silver Cloud package. It doesn't suit everyone, so there is obviously a care professional, a mental health professional that can be accessed beyond that that system. So the reason I wanted to alight on mental health is we've all been through a very, very challenging period, and what we do know is that the anxiety and the worry that has come with that, even though some of our life is feeling a little bit more normal in terms of where it was before the pandemic, but nonetheless it does leave a mark. Now, I think that's enough from me. I am very grateful. As always, I want to mention our partners in Powys Association of Voluntary Organisations, partners in Powys County Council, and in fact across the public sector here in Powys. Police, the Fire and Rescue Service. I could go on and on because this has certainly been a team effort in responding to this pandemic. And then most importantly, I want to thank the communities of Powys for supporting our work here as a health board in trying to help us all move through the pandemic. We're only a few weeks away from the end of this year. 2021 has been an eventful year, as was 2020. And as we look forward, I certainly hope that as we move into 2022, we will increasingly be moving out of the pandemic into a life that we recognise as a bit more like it used to be. Or else it will be our new normal. So diolch yn fawr, thank you very much indeed for listening to the update, and here's the exciting bit. We're going to move to questions next, and I'll do my very best. And what I would say is if I don't know the answer to something, I will commit to try and finding out, and we'll make that information available. So if I can hand back to you, Adrian, I think you're going to take us through some of the questions.
I am indeed. Thanks very much, Carol. And you mentioned there earlier about flu vaccination in pharmacy and the common ailment scheme. And actually, I used them both myself just this last week as well. So I had my flu vaccination in a local community pharmacy in Powys and was able to use their common ailments scheme. Obviously, they do acne, athlete's foot, back pain, chickenpox, cold sores, colic, conjunctivitis, constipation, diarrhea, dry eyes, dry skin, hemorrhoids, hay fever, head lice, indigestion, ingrowing toenails, intertrigo, mouth ulcers, nappy rash, oral thrush, ringworm, scabies, sore throat and tonsillitis, teething, threadworms, vaginal thrush, and warts and verrucae. So many different things they do, but no bets on which one I was accessing them for. We've had some great questions in tonight, and the first one coming in with COP26 taking place recently. What steps is the Health Board taking to tackle climate change?
Oh, what a fantastic question, and I'm so pleased that you've asked this because goodness me, hasn't it been a fortnight of drama to start off with, but illuminating really the impact that climate change is having around the world. And I haven't watched every moment of it, but the reports that I have seen have been hugely impactful, and the small islands in different parts of the world and how they are being affected by climate change. And I doubt that there's anyone who doesn't know what 1.5 means and the need to keep to that. So what does that mean for the Health Board? So back in September, so not that long ago, the board at its public meeting, which is available on our website, by the way, if you do want to go and have a look, made a public statement about its commitment to decarbonisation, so the climate change agenda. There is a detailed plan that has been published and developed and published by the Health Board. Please do feel free to have a look at that. But I think it's fair to say that this is only the next step in terms of what we need to do. Our focus has been on our built environment, the way we heat, the way we light, our estate more generally, transportation, and the way in which we use our physical environment around us to try to reduce carbon and our carbon footprint. But I think that this is an area that I'm particularly keen that as a health board we lead the way on as much as possible. And I think that means this becoming a social movement. So not just what our estates department does in the health board, but what every single department does in the health board to reduce carbon, what every single individual does to reduce carbon as much as possible. So there's a lot of detail in there. We're aiming to be the first health board to have carbon literacy accreditation. That is a level of knowledge and understanding and action that flows from that, that is accredited by a climate change and decarbonisation company sponsored by Welsh Government. So that hopefully shows the commitment. If I can just mention something else while we talk about climate change, I want to talk about the biodiversity as well, because in that very same item we discussed and we took an item on biodiversity. There's been quite a bit of coverage over the last couple of days on biodiversity and its importance. And I think there's still a bit of a debate to have about how we try to move that agenda along as a health board. And this is a slightly tricky one. We've had a debate in the health board with colleagues about to mow or not to mow. Should we be mowing our lawns? We've got extensive grounds and gardens in some of our sites, and we've been used to keeping them neat and tidy. So how do we try to achieve a neatness and tidiness, but by also trying to develop places for insects and small animals to live and thrive? So we're having that sort of debate, but we are taking both of those things very, very seriously. Please do keep in touch with us on climate change, challenge us, congratulate us where we get it right, but we're going to be working very hard on this. So thank you very much for that question.
Thanks, Carol. Now, it's almost inconceivable to think that we're now looking back across nearly 2 years of the pandemic. And with hindsight, is there anything that you'd have done different?
Oh, right. Well, I wonder if I can not just go back 2 years, but go back to 2009. So I met with a colleague earlier, and we ended up talking about swine flu. Now, I don't know how many members of our community will remember that there was a really significant concern back in 2009 about swine flu. I was a manager in Women and Children's Services in the Gwent area at the time, and I remember being part of a planning team to try and manage a swine flu outbreak and how we would manage antiviral medication, etc., etc. So probably my one big thing that I would do differently would be to have planned better for a pandemic. And the reason I say that is that the swine flu, although we planned very hard in action, it didn't come to the fruition that we had feared it would, and we were very relieved. But the sense of at some time a pandemic or a major public health emergency was going to come. Now we had done planning for flu pandemic, but in terms of COVID, SARS, so that type of virus, I think it's now very commonly understood that well, the country, let alone the NHS and here in Powys, had not planned to the extent that really we, in hindsight, we should have done. I don't want to take any message away from my statement there that means that we didn't plan as we got more and more information coming through to us about this pandemic. I remember so very vividly the first conversation that I was involved in about this COVID SARS virus. And it was a national or Wales one, and it was towards the end of January in 2020, when a public health colleague was reporting what was seemingly emerging in China. And the colleague said, I think we might have a moderate pandemic. And I remember leaving there thinking, really, is that what does moderate look like? Well, we didn't really know what was coming. And I know that we will do a lot of reflection about could we have known more about what was coming. But what I would say, and I pay tribute to my colleagues across the health board, but across our partners as well, that when we got a sense of an emerging pandemic, the speed with which people planned, the speed with which we changed the way of working, we had to adapt, all of this technology, we weren't using it in the same way. And so I am really pleased with how quickly we responded. But my probably one big hindsight moment, there will be others, but the big hindsight moment is, could we have planned more for an eventuality? And I'm pretty sure I won't be alone in having that reflection.
Thank you, Carol, for those open and frank reflections. So that's thinking about looking back over the last 2 years. Our next question is about looking forward. So what do you see as the biggest priorities for you in 2022?
Oh, there's lots to do. So first and foremost, we need to get through winter. The way to get through winter is to make sure we're all as prepared as we can with our vaccines, etc. We've done all of that today. So that is really, really important. And trying to manage through winter is key. Winter's always really difficult for the health service, and this year it's going to be even more difficult because winter's really started for us back in the summer, and it's not let up yet. So getting through winter's key. I'm really focused on how we can try to support our staff and our colleagues across the health and care system to recuperate, if you like. I need to find a better word than that, but I know colleagues are still feeling very, very tired, and this winter's unlikely to make that go away. But as spring comes, I am certainly hoping that we can encourage our staff to make sure they've taken their holiday, doing everything they can around their own well-being, and we'll be continually looking for feedback about what more we can do as an employer who I hope puts our staff colleagues at the heart of what we do, to really stretch out and support our colleagues, because when we've got staff who are feeling energetic and motivated, we know that turns into great patient care. So focusing on staff is really, really key. And then the very big thing will be, how do we make sure that people who've been waiting for some considerable time can access their planned care, whether it's an outpatient appointment or some surgery. And those numbers, those 19,000 people who are currently on a waiting list, they are really very important to us as a health board. And so 2022 is a year for us to really motor. Now, we're making progress, some of it very good progress, but it is a risk now over this winter period. But that is what our big priority will be in 2022. That's me saying this in the hope that we will have moved through the pandemic, and that COVID rates will be lower. I'm pretty sure there'll be vaccination somewhere in there to maintain that. So we've got to get a good plan for next year's vaccination programme. But for me, there are big things. And if I can just take a moment to think slightly more broadly, we've got some other really big and important strategic developments. We've just talked about the climate change agenda. That's very important to me. But I also want to raise the North Powys Wellbeing Programme that we're working with the local authority and other partners on. That is very, very exciting as well. So the agenda for the health board is jam-packed. There's a lot to do. It's going to be a very, very busy time for us over the next couple of years. I'm looking forward to 2022 and hoping that we move through this pandemic. Thanks very much for your question. Of course, if people are listening to this, watching this, think there are priorities that we haven't mentioned, always please get in touch, because at the moment we're doing our planning for the next 3 years. We refresh that every year, so we reassess the priorities, and that plan is a little bit of information going to our board next week on it, but the plan in totality will be presented at the board at the end of January. So please get in touch if you think there are things that should be a priority that you can't see at the moment.
Thanks, Carol. So on that issue of vaccination, we had a question on Facebook asking if my child was 15 at the time of their first dose, but they've now turned 16, will they be able to access their second dose? And short answer to that is yes. So that's great news as people turn from 15 to 16, 17 to 18, etc. Then the new guidance in relation to the group that you're entering starts to apply. I think I'd just add that's really important as well, for instance, with the booster programme. So there might be some people, for instance, who at the time of their second dose weren't working in health and care or didn't have a diagnosis of underlying condition. So if, for example, you've moved into an eligible group since your second dose, make sure you get in touch with us so that we can offer you your booster, because your records might not show that you're in that eligible group. So really important to let us know. And I think another comment on Facebook that reflects how fast this is changing is that the latest guidance from the JCVI yesterday now recommends it's actually 12 weeks for people under the age of 18, now 12 weeks after a COVID diagnosis. So if you had COVID infection, then you should wait 12 weeks until either a first or second dose. And that applies to the under 18-year-olds who don't otherwise have an underlying health condition or in a clinical risk group. So that does mean maybe just a slightly longer wait for those 12 to 15-year-olds who might have had a COVID infection last month and haven't yet had their first dose. But our drop-in offer is still there for you and will carry on being available for the coming months. And just in a few weeks, next question was, we're coming up to the first anniversary of COVID-19 vaccination, and looking back on the last year, what are you most proud of in that vaccination programme?
Oh, goodness me, you're going to make me cry now, because I'm proud of it all. I've been blown away by the commitment of colleagues in the health board. So just imagine, this was a service that didn't exist. Nothing existed. And so last November, literally 12 months and 2 weeks ago, we were getting news that there may be something really promising coming through. So out of nowhere, our staff came together and set up what has been an absolutely leading vaccination programme. So I am enormously proud of health board staff. But can I extend that pride to our partners and our colleagues, the volunteers? We could not have done this vaccination programme without the volunteers. They have been brilliant. So if you are a volunteer, my sincere thanks to you. If you know a volunteer, please pass on my thanks to them. If you're thinking, I wouldn't mind volunteering, please come forward. I've had many a conversation with a volunteer, whether it's dark and raining or sunny and beautiful. People have got a lot out of that volunteering experience. People are not always able to do long-term volunteering because of work and college commitments and other things. But that has been so valuable. And I know you're looking at the thing I'm most proud of, but I'm proud of it all. And I am most proud of the Powys population, because I mentioned it earlier, there is something about the Powys communities who you would imagine that because of our rurality and our challenge, there's every reason not to pitch up for a vaccine. But people have, and I've met many people when I've been in the vaccine centre myself, and it is absolutely heartwarming to meet people, to hear the stories, for people to express how pleased they are to get this vaccine. And we're delighted that so many people have come forward now. I think we could be leading the way in Powys for the rest of this vaccine programme. So very hard to pull out one single thing. So I hope the questioner doesn't mind me hedging my bets and pulling out a couple of areas. But thank you all so much for such a sterling job. Really is excellent.
Fantastic. Thank you, Carol. And I think I personally echo that. It's difficult to single something out, isn't it? But the people of Powys have been absolutely amazing in terms of their response to the vaccination programme and the steps that so many people have taken to make sure that it's a success. So thank you so much to everybody for that. Now, I'm conscious of the time. We haven't been able to answer every single question, but with just a few minutes to go, I think, Carol, this is your opportunity to make any closing remarks before we close this evening's session, if that's okay.
Yes, thanks. Thanks ever so much to Adrian and to Tin, who help us put this session on for our friends and colleagues, our communities across Powys. As always, I do hope that this has been informative and helpful. We're always open to feedback about the things that you'd be most interested in hearing about, and we can update you on that. So, you know, as the nights have now drawn in, and looking out of my window, out of my office here in Powys, it's complete darkness. I do want to wish you all a very good winter, and please do prepare all you can for your own self-care and to help us as an NHS and social care system to support you. So if you can do that, that would be fantastic. And I hope that as the turn of the year comes, we can be again more optimistic for this coming year. In terms of what that holds. What I certainly know is that as a health board, we will need to keep working hand in glove with people in Powys communities and our partners. So I'm very grateful for all of the support the community show to us as a health board. We don't always get it right. We would do our absolute best to try to improve health and well-being throughout the county. But thank you very much for all your support, and I look forward to catching up again soon at another one of these sessions. So diolch yn fawr iawn. Thank you all very much indeed for tuning in and for the questions, and see you again soon.